there, welcome to our booth at the APTA conference CSM 2015. We've been having a great week here. We talked to a lot of physical therapists about how to use our shoes, the variable friction shoes by Cadence, with their patients. And we have a couple rigs I figured I'd just show you to give you the same experience all the other physical therapists are getting. So if you come in here, this is our little test rig that we developed. And why don't you come into the front so you can see how it works. So our shoe offers two different levels of friction. And this is going to show you in just a second. So here, this is the shoe as it was coming across, maybe in swing. If your patient accidentally contacts the ground, it can slide. But as soon as you put that weight on it, it sticks to the ground just like a high friction shoe would do, any other high friction shoe. So again, from the side, this compressive foam right here is going to squish, and that's how you're going to get that high friction contact with that rubber in the middle of the shoe. But when it's in that low weighted state, this is how it slides around really easily. So I want to take you to this other booth right now and just show you this other demonstration. So this is a standard rubber bottom shoe. So on this shoe, it's a very highly recommended shoe by physical therapists a lot of times because it has this wide base to it. It's got a nice rocker shape in the front, so maybe you get a little bit more ground clearance with that. And it has that really high traction. But the problem with this type of a shoe when you have a neuro patient that's having difficulty advancing the foot forward during swing is that it sticks to the ground in certain situations, especially carpet. This is the most dangerous situation for a neuro patient with these types of shoes. So on carpet, this coefficient of friction is 1.4. So what that means is for every pound of force that your patient is putting into the shoe, it's going to grab that ground with 1.4 pounds of force. So for example, if they scuffed with a 10-pound scuff, all of a sudden now they have 14 pounds of force pulling them back and causing that forward tipping torque. So just to give you the demonstration, this is what we've been doing with all the PTs here. We take this, we're trying to clear the foot during swing, we miss, and all of a sudden it just grabs. It's almost like Velcro sticking to that ground. With the Cadence shoe, if you accidentally contact the ground during swing, what happens is it just slides. This coefficient of friction in the low friction state is somewhere around 0.15 to 0.2 in this situation. So again, if you put that 10 pounds of force, you're only getting 1 pound resisting this motion. Very easy to get your foot forward. But as soon as you put your weight down, just like we showed you on this rig, you get all of that traction again for stance and for push-up. So that's a little bit about how our shoes work. This is the demos we've been giving to all the PTs here this week. We've had a great time. We talked to probably 500 different PTs at this event. It's been awesome to hear the feedback. People coming to the booth saying, my patient already came to me with these shoes and I wanted to know how they work, so thanks for showing me. So it's been a really fun show like that. It's been fun talking to them and walking them through the steps of what PTs should go through with their patients getting used to these shoes. For most patients, it works right off the bat, about 70% of the patients. 30% of patients will take a week or so to get used to this difference in feeling. They've never walked on a low friction surface before, and now you're putting them on one. But with our shoes, they get that high friction back immediately when you put the weight on it. So that's how they work. I hope you had a good time visiting our booth at APTA CSM 2025.